This is a hospital that we work with in the Southeast, mid-size hospital, large units. And so this was about a 70-bed Med-Surg unit. They called about a vacancy. And I think that they were thinking that we were just going to give them an interim leader and kind of go about business. In conversation, though, with the CNO, I really kind of dove in to understand what the problem was. Had seen through COVID lots of transitions in leadership, lots of transition in team, and really was facing some of the typical issues that we're seeing in hospitals across the country: high vacancy rates, kind of opportunities with patient satisfaction, opportunities with patient outcomes, and really just needing some stabilization. And so in talking with the CNO, what I did was recommend our transitional leadership, which is really going in and starting with an assessment to kind of get to the root of the problem. That's where we started, and we have been there for almost a full year, and really have seen some tremendous outcomes. One of the fun things for me about this project is really the relationship that has been built with the leader that we placed, as well as with the CNO. I go on site about every other month and spend 1 to 2 full days with that leader, as well as the CNO, diving into what are the problems both within that unit, but what are the problems maybe that we're seeing at a broader scale within the organization that might be contributing to kind of some of the outcomes on that unit. We worked on everything from falls reduction and saw a 50% reduction in falls with injury throughout the course of the project. And then we worked on a care delivery model. So one of the biggest issues that they were facing was vacancy and turnover, typical of most Med-Surg units. So we looked at implementation of a care delivery model and reintroducing LPNs to the workforce. And when we started in the project, they really were not using LPNs, and now they're using them 95% of the time. The other thing that we really needed to take a look at was agency utilization. It's not a long-term solution for organizations to use agency. And so we were able to eliminate 7 agency nurses, which equates to, at the rate that they were looking at, over $1 million annually. Our work helps get the data and information solidified that sometimes it's hard for leaders to put their hands on. And so oftentimes we see leaders at the front line, specifically in manager roles, not really sure where to access all of this information. And so when we go in, we have to ask that question, right? Where do we get it? And so what I hope that we do when we do these projects is not only make it better right now, but set it up for the leader that comes in to have almost an inventory or a list. This is where I go for this. This is where I go for this, because sometimes that can really be a challenge for nurse managers, especially. I continue to work with this organization on a few other projects, but we are continuing to be involved in the recruitment for a permanent leader for the position. And I think that's really cool because my relationship with the CNO, I really know what she's looking for. And I think that offers a difference to her in true recruitment.